Got it. So much. All right, y'all. I'll just start over. I am the outreach and health educator for A Step Ahead Chattanooga. And we are here together to have some tough conversations with these wonderful panelists here that are going to talk a little bit more about self-advocacy when it comes to reproductive health and mental health together. And so we have Rachel Geringer with Nami Chattanooga here helping me facilitate today's conversation. And you'll get to meet the panelists here in just a little bit. So let's go ahead and learn a little bit about our two organizations. I want to share our mission and values with you from A Step Ahead. So our mission is to remove barriers to contraception through education, outreach, and access to free contraception. And we believe that, when individuals have access to that accurate information and access to the contraception, they are better equipped to make those decisions that are right for them and their family in their time of life as well. And we believe that our health services should be provided free of judgment in a very caring, respectful, and safe manner. And our services, I don't know if y'all knew, are open to all individuals who are in need of education and access to birth control. We provide free IUDs and implants to anyone in our 18 counties who live or go to school in Southeast Tennessee, North Georgia, and North Alabama as well. And that is regardless of your insurance or income status. So I'm going to let Rachel talk about the mission and values of Nami Chattanooga.
Hi, everyone. I'm Rachel Geringer, and I'm the board vice president for Nami Chattanooga. And a little bit about what we do. First of all, Nami stands for the National Alliance on Mental Illness. So Nami Chattanooga is an independent nonprofit that is part of a larger statewide and national network of Nami organizations. So we're kind of like part of this big family, but we work locally. And our mission is to improve the quality of life for individuals with mental illness, their families, and communities through mutual support, education, and advocacy. Something that you're going to learn from us this evening is that we really believe in the value of sharing our lived experiences. So we have a couple of people who are going to introduce themselves in a couple minutes who are going to be talking from their lived experience. And we're really passionate about creating intentional healing spaces based upon, oops, now I can't see it. Sorry, based upon the foundation of respect, friendship, and compassion. And so through education, support, and advocacy, those are the three main things that we focus on. We believe that we can better equip families to care for their loved ones, and in turn, strengthen our communities and create better lives for those in our communities that are living with mental illnesses. So that is a little bit about us.
Awesome. Thank you, Rachel. So I want to bring up the topics that we're going to talk about today and the agenda for the evening. So we are going to kind of briefly go through what you have signed up to participate in today through self-advocacy. So you'll learn about what self-advocacy is, and then the numbers of why we are here talking about that. So the data that backs up why we should be having these conversations. And then you'll be introduced to our panelists after you take a poll. So a poll of 6 questions, just kind of gauging where what you've experienced. And we want to hear from you. There's 6 questions. So we'll bring that up as well. And then we'll have our panel discussion with a Q&A as well. And we'll talk about some resources. So Rachel, you wanna cover our topics?
Yeah, so obviously we're going to be talking about accessing reproductive and mental health care, and just talking about kind of some issues that people may face trying to access both of those different types of healthcare. Both of them are kind of conversations that, some people may be really afraid to have with a provider, and actually, some of the issues that people run into may be kind of similar. And so these are some of the kind of themes that we're really going to be getting at today is some of the issues people may have finding you are just scrolling here. Where are you going?
I'm so sorry. I'm trying to figure out like where my mouse is, and it's like hiding on. Sorry about that. Continue, my friend.
So struggling to find the right care provider, that is something that we're gonna kind of touch on today is how do you find the right healthcare provider? What does that look like? Facing any potential biases in healthcare. What do? If you are facing any biases, how do you overcome that? How do you respond to that? We're also going to be talking about, sticking to it for the long haul. So meaning you might not find the perfect fit right away, and how do you kind of deal with that? What do you do in response to that? And then also making sure that we are empowering people to really convey what is going on with them and their bodies and their mental health, and being able to kind of speak up for themselves, and feel like they have a voice. And then also going to be talking potentially about barriers like paying for healthcare. So really excited to be here and come together and talk about two, kind of, again, difficult conversations for some people to have with a healthcare provider.
Yeah. And that just brings us straight to self-advocacy. And I think, Rachel, you kind of hit the nail on the head here, is like speaking up for, our health means sticking with it for the long haul, right? I think having access to these resources and then having somebody supporting us with what is right for us. Is our healthcare provider the right fit for us? Like all of that comes along with this self-advocacy, but you also need to know what you're fighting for yourself, right? So that means knowing yourself. But can you add on what you think self-advocacy is? Rachel, would you mind adding on? Rachel G.
I thought you were asking them a question.
No, I was asking you.
Oh, I'm so sorry.
And then I wanted to be like, oh, there's two Rachels. I have to be sure to say.
Yeah, there's Rachel G, Rachel
yeah.
E.
So just adding on.
Yeah, so really self-advocacy is kind of the ability to, first of all, be in touch with what you need as far as your mental health care or your reproductive health or any type of health care, and to be able to kind of, I probably shouldn't use the word in the definition, but to advocate for your own needs, and really feeling like you are empowered with the resources and tools you need, and the skills to advocate for your needs in accessing healthcare. And we really want the goal to be for people to feel like they can get the very best care that they can get because they're kind of speaking up and saying, this is what I need to be healthy. And so, it's basically learning how to be your best advocate for your own healthcare.
And I always say, like, when I'm out teaching about birth control, is like, you know your body best, and nobody else knows that. And so speaking up to even your family members or individuals that you might live with who can help you advocate. So thanks for adding on to that. My mouse, because I hit it in full screen, like it keeps hiding. Sorry about flipping through the screen. So can you move into like mental health treatment? Like, why are we here having this conversation? These are hard numbers. hard
Yeah.
numbers to kind of
So
swallow.
this to me is really is why we're here. This is why, we at NAMI Chattanooga do what we do. And that's why we think that this is a really important conversation to have, because I think that if we can, empower people to be better self-advocates, that could hopefully maybe impact some of these numbers. That might not be the entire problem, but it could potentially be a step in the right direction. And the unfortunate reality is, the average delay between a person having symptoms of a mental illness and getting treatment is 11 years. 11 years, y'all. And during that time period, people don't tend to get better, right? And we know that we can have better outcomes if people are getting help and treatment earlier on. Over 50% of adults who have a mental health condition don't receive treatment in a given year. And that number is very comparable for youth with a mental health condition. And then this is another very difficult statistic for me, is that 70% of those who seek mental health care drop out of services after their first or second visit. So that is individuals who have reached out for mental health care, but for whatever reason have decided not to return after just 1 or 2 visits. And so some of what we're going to talk about today is, what do you do if you go to an appointment, if you take that first step of reaching out? And that's really hard, right? To take that first step. What do you do if you've taken that first step and it's just not the best experience? Like, how do you deal with that? How do you overcome that? Because that could potentially be one of the reasons why people choose not to go back. Maybe they don't have a great experience. So we're really all about, making it so that people are getting the best possible care that they can get, and that we are advocating for the best possible care that people can have.
I know, I think about that too. Like, it reminded me of so many times where I was like, I'm gonna go see a therapist, and then I go and I'm like, oh, I didn't like that person. I didn't like that he brought up all of my childhood trauma, and then I would just quit going, right? And then all of it comes back, and I'm like, okay, I got to go see another therapist. And I'm like seeing so many. Mm-hmm. And just even for this past year, in 2020 started seeing a therapist, and like, she made me mad. I'm like, I'm not going back to her. And she's been my therapist for like 5 years. I'm like, I'm not going back to her. She made me mad. I'm like, okay, check yourself. Like, I got to stick with it because it's helping. Yeah. And I do know that it's helping. So, but these numbers are, it's pretty stark. So looking at reproductive health, and like, A Step Ahead has really started focusing on rural areas in this last year. I mean, we've covered the rural areas since 2017, but we've finally got health educators now who are planted in these areas doing some hard work. And these are the numbers that kind of pop up that are bleak. 405,480 Tennessee women, just in Tennessee, are in need of birth control, and they lack any reasonable access to a full range of methods. So we just look at the rural areas too, and see that we don't have enough health providers there. We don't have enough clinics. So when you see 42% of women are living in counties here that don't even have a health care provider that they can go and see for their reproductive health care needs, a lot of our clients are coming from, Franklin County to Chattanooga. And that, if you've ever taken that drive, it's like an hour drive. So that can become a barrier in itself. So it's not just the access of like, can I get it, but how do I get there when it's so far away? And then the last number is that 58% of women in reproductive age reported seeing an OBGYN in the past year. So we start thinking about like, well, why is that? Is it because of the access? Is it because they don't have a healthcare provider, a regular healthcare provider that they can reach out to? And when we think about these numbers, we know that if we're not having those regular checkups, other things could potentially happen. The cervical screenings, if you're having unprotected sex and you're not getting a regular checkup for that as well. But for our work specifically, that's our mission, is to provide free access. And even in those rural communities, it's still a difficult journey to travel over the mountain and come into Chattanooga. And so we're so thankful we did end up getting a clinic in I think Grundy County, Mountain Medical, and they're able to serve the folks there, which is really good, but that's just one clinic. And so I think that is number one, is making sure we have those healthcare providers and those conversations of like, how can we do that? Telehealth has taken this huge leap into making sure that people can get contraception through the mail now. So that's super exciting. And I'm going to go through this briefly, but the health disparities here, when we're talking about percentage of pregnancies related to deaths, were deemed preventable, 90% in 2017 and 2019. And then I don't want to leave out a subgroup of folks, the LGBT group. Trans individuals, 29% of them said that they don't even want to go see a healthcare provider because of, they're being refused or made fun of or just not feeling comfortable. And then lastly, when we're talking about even paying for care, we've got 16% of Black women in the South don't even have insurance. And that is the highest percentage in any region. So we can begin asking, these questions like, do I have access to healthcare? But if I have it, do I really want to go see that doctor? So finding the right fit, all of these things are so intertwined, and I'm really grateful that we're having this conversation, because it is hard to see these numbers, y'all. So with that, I want to introduce the panelists, and we'll just do like 30, 60-second introduction to our folks. And I guess just raise your hand if you're ready to fire it up, y'all.
That's right.
Go ahead, Kathy. Yeah.
Trying to unraise my hand. Okay, now I'm ready. Well, first of all, thank you, A Step Ahead, for this amazing opportunity to talk about two really important issues. And I'm very impressed with your statistics too. I'm learning a lot. So I'm Kathy Milam. I'm a mom. I'm a grandma of a very wonderful little grandson, Oliver. And also I happen to be the president of Nami Chattanooga. And next to me is one of the most strong, courageous, amazing people I know. And do you want to introduce yourself?
My name is Amy, and I am her daughter. And I have bipolar 1 with psychosis. And I did not speak up earlier, but I self-advocate for myself by being proactive with my doctors, with therapists, with my medicine. There's a lot of trial and error that goes on with it. You really have to stick to it. It takes patience. It doesn't always happen right away. I like to advocate by fighting stigma. With even small things like using different words to describe symptoms that are more less negative in connotation, like the difference between psychosis and distressing beliefs. It's easier to talk about having distressing beliefs than having psychosis. And then finally, I self-advocate with having a treatment plan that works for me. So, hi.
Right. We're glad to be here.
Such great points, Amy. Thank you. Dr. Toombs Withers.
Hi, everyone. I'm Dr. Shayla Toombs Withers. I am a family physician and owner of Essence of Health Wellness Clinic, which is a family practice clinic here in Chattanooga, Tennessee. I am excited about this topic. It's so much needed, not only in our community, but in our country as a whole. I have worked in aspects of family medicine and with concentrations in women's health, and have focused a lot, even with health disparities, which is a lot of what I do in my practice, in providing preventative care to try to lessen a lot of those health disparities that we see in our community. So I'm happy to be here. I'm happy to be discussing these topics with you all. Thank you.
Awesome, thanks. Nicole, you're up.
Hello, I am Nicole Montgomery. I am a family nurse practitioner, currently working in women's health. I work for Women's Surgery and Aesthetics Center here in Chattanooga. I provide a lot of care, GYN care for women, focusing in on the endometrial pain, pelvic pain, reproductive health, hormones, all of that gambit. It's a passion of mine. I've worked in women's health for about 10 years now, and started off as labor and delivery nurse. So women's health is definitely at the heart of everything that I do. And I really appreciate being here today to shine a little light on helping people advocate for themselves and just finding their way and knowing that you have rights and we're here to help guide you along the way.
That's so good. Thank you, Nicole. Ricky, I'm gonna spotlight you. I'm gonna remove. I'm learning, y'all. I'm learning.
All right. Hi, my name is Ricky O'Donnell. I am a participant also with bipolar 1 with psychosis. I got diagnosed last summer, so summer of 2020 during COVID. That was a great time to be hospitalized and away from my family. That's sarcasm. It was terrible. And it was terrible to go through. And I'm only just now starting to really talk about it outside of my family circle. A lot of people don't really know, but I'm kind of tired of the hiding, and I feel like I have a lot to share with what I went through. I had always been diagnosed with clinical depression since I was 16 years old, always been on birth control since I was 16 years old, but the bipolar did not manifest until I was about 40 years old. So it was a crazy process, and we'll get to that later. But I definitely admire Amy because I've been through exactly what she has been through. And the process also allowed me to have my sisters as powers of attorney for me, so they could have my care, and my husband take care of my care when I could not. And it led my husband and I to choose an IUD later, because a bipolar symptom can be, sexual over-sexualization of yourself. And I just didn't want him to have to deal with that. So it's one of the choices we made. So that's me.
Oh, thank you for sharing. I can't wait to hear more. Thank you. Laura.
Hey, I'm Laura Pierce, and I was in public accounting for years, so didn't exactly prepare me for this topic tonight. But what I can say is that mental illness, as you've seen, is really common, and it impacted my life in full force probably about 6 or 7 years ago. My son, who's 29 now, has schizoaffective bipolar type diagnosis, and we have learned a lot in the last 7 years. There's a lot of self-advocating you have to do, a lot of care, and I'm so proud of him and how he's making it through this journey. There's a lot to face, but there's a lot of hope too, and good places that you get to. So I'm really thankful to be here tonight, and part of the Nami portion of this, and with Step Ahead. Thanks.
Awesome. Thanks for sharing, Laura. Wow, I'm so excited. This is a great group of folks, y'all. So it is poll time. The lovely Rachel Endo created our poll questions. So the first one is going to be so fun. What is your favorite type of cuisine? We're just practicing here, y'all. Can y'all see it? Give me a thumbs up. Are we good? Cool. 6 questions. Yeah. I'll just read the fun one first because that's the most fun. I love food. Where's my music? Ricky, was that you? I'm just kidding.
I mean, I can probably sing badly, but
I have to remember that component. I'm like, that's all right. I can play it maybe from my phone. I wonder if it will pick up.
that's what I do when I teach online. I just put my phone speaker right up to my computer.
Yeah. Can y'all hear it? You know me, I'm gonna play some meditation music. Ooh, lots of people like Italian. Okay. That's my least favorite. Yes, vote.
Hey,
Panelists, you
Italian's
can
my
vote.
least favorite too. I always feel so
Really?
out of the loop.
Yeah, I do too. Everybody, my whole family like loves Italian. I'm like, that's my least favorite. Give me Asian every day. Like, I love Asian food. Sorry, Brooke. Coming from the Italian. Maybe we haven't had your pasta. Like, you need to make us some pasta. Awesome. 61%. Okay, 25% like Mexican. Yes, I could get on with some Mexican. I like Mexican food too. All right.
When it's done, you can share the results to everyone else.
Yeah,
Okay.
I'm going to. I'm gonna give y'all like one more minute. We've got 64 people who've participated. So question number 2. I've only done polling like one time. So Rachel, when I hit end poll, I can go through each one. Is that correct?
Yeah, and you can do share results.
Perfect.
And then it'll pop up on everyone's screen.
Yes, that's what I want. Then you guys can see what I see. All right, I'll wait till we're about, oh yeah, 76%, 10 more seconds. Awesome, y'all. All right, we've had about 76% of participation. So I'm gonna end the poll and I'm gonna share the results. Okay, can you see them? Can you see them?
Yes.
Okay. Nobody was saying anything. I'm like, ah. Okay. So y'all got the results. Most people like Italian food. I think Brooke rigged it. All right. Number 2, how many medical providers have you seen who were not a good fit for you? 60%. So 1 or 2. Okay. What types of implicit biases exist in healthcare? Ooh, 80% said all of the above. So race and ethnicity, weight, sexuality, and none were the answers. So all of the above. What is the longest that it has taken you or someone in your circle to get a medical issue correctly diagnosed or treated? 4 to 6 months. Look, some people said greater than a year, y'all. But our largest group is about a year. 10 to 12 months. Have you ever felt like a medical provider wasn't taking your concerns seriously or didn't find your concerns to be concerning? Man, 80% of people said yes. That's pretty serious. That's serious. What barriers to care have you or your circle experienced in regards to insurance? So no provider in network in your area, 20%. So a lack of access to providers. Procedures or medications not being fully covered, 50%. Yeah. Procedures or treatments recommended by a medical provider not being denied or covered. So yeah, I'm gonna stop sharing and let's head back to my shared screen. So as we think about our audience, does that seem pretty normal to my nurse practitioner and my doctor in the room? Does that seem pretty normal, like those results?
Unfortunately, yes.
Unfortunately.
Yeah. Yeah. So I'm glad we're here having these conversations, y'all. Yeah. So let's go ahead and let's chat. I think that's what we're gonna do. I'm gonna put it on gallery view. Yeah. And Rachel G, do you want to start with the first question?
Yeah, so we're going to kind of ask, the way that we're going to do this for most of it is going to be questions that can be answered either about reproductive health care or mental health care. So it's whoever wants to answer. No one needs to feel like, oh my gosh, I have to answer every question. If you're not feeling it, you don't have to answer it. No pressure. This is informal.
Yeah, and just raise your hand too, because I think Ricky wasn't here when we discussed it. So just like raise your hand so we're not chatting over one another.
Yeah. So talked earlier about some of the issues that people have when, you know, first reaching out for care and how hard that can be sometimes for people just to like make that appointment. That's a huge first step. What advice do y'all have for individuals who are accessing care for the first time? Could just be general advice. They have that first appointment set up. Dr. Toombs Withers?
Yeah, so I would advise one for folks to go onto the website of that clinic or that provider they may be going to see, so that they can, one, know what that person looks like. Two, they can look at their background, you know what type of work that they've done, and to know, you know, if that may be something that they may be looking for their own health. And then, you know, the other part to that is see if that office or that provider may have a meeting with you. One of the things that I do in my practice is a bit different because it is more of a concierge type of practice. It's not traditional. But I offer a meet and greet. It's free. It's virtual. It's just like this, where I can sit and I tell the patient about myself. They tell me about themselves. And, you know, we're able to see if, you know, they're able to see if I may be a good fit for them, see if they may be a good fit for my practice. And, you know, there's no charge, there's no pressure, anything with that. And so, you know, call and see and find out if that may be something, you know, that someone you're interested in seeing may offer some type of meeting so that you can get a better idea.
Thank you. Anyone else want to add? Kathy or Amy?
I think just as a consumer, it's hard to get over the stigma when you're brand new to mental health care. And so I think accepting, you know, that is probably the reason why so many people drop out. I have a friend of mine who's bipolar too, and he needed to get on medication. He's talking about getting on medication, talking about going from his general provider to his psych, and it never happened. And so I was like, well, make the appointment. I kind of acted like his assistant, and he got his appointment made. And I think even though there's so much that we can discuss and share, there's still the fear of the stigma so much. And also giving up control. I think that people feel like they're in control and don't want to give it up. And I know that for myself, I've gone through so many different stages of letting go of the control. So it is hard.
Thank you.
Thank you. Sorry, I was trying to type in the chat.
I was gonna say, I
you
think
have to
Ricky
say
has
yes, I'm over
Ricky has
here.
her hand up.
Yes. And Nicole, I think Nicole had her hand up first.
Oh, I'm sorry, I didn't see that. Yeah.
No, me? Okay. So I know one of the most frustrating parts for me was even getting to that step, which was I had to go through, 20 different people before I could even get a provider that was accepting patients. And when you're in a crisis situation, that was even from the crisis center. And it was my sisters that were doing it for me. I was pretty much very basically controlled, bipolar wise. I was still going in and out of mania and depression. And then they got one on the books and I finally got in, but it helped me for them to create like a diary of what I was going through or what I needed to talk about. And then I added things as I could, because if I was in a good state to do that, and then I could take that to my first meeting with whatever doctor I could find and then, get it going. And I managed to find a good one, the first time around that has been good to me, but I've been there where I haven't. So.
Very good advice. Nicole?
I agree with everything that's been said so far. One thing that I always tell new patients is come with any questions that you may have with me. That way we can go through the list. This is a partnership. This is not a dictatorship. We go through things together and we try to figure out the best way to manage your health. I always want to know what previous experiences were, like where did you not feel like that you weren't heard? Because I think it's important to share that with the new providers so that they're aware that you've had these not so good experiences in the past. Doesn't mean that they're going to be the best fit for you either, but you never know. But if someone knows and can understand you a little bit better, I think that makes the relationship better. And if you're not a good historian, write it down, write everything that you can think of, because in that moment, you're nervous, you're meeting someone new, you're trying to come up with a plan for something, you already may have apprehension from previous experience. So just write as much stuff down as you can for your history and any questions that you may have and bring it. I don't ever mind people bringing pen and paper. It's great.
Miss Laura?
I'm going to piggyback on what Ricky said. When we moved, or my son moved back from California here, we didn't have a psychiatrist, and I can't remember what the wait was. It's just an extraordinary amount of time to be able to get in to see one. So he ended up having an inpatient visit, and I know we talked with the nurses there, and he talked with them as well, trying to figure out the best time to ask the person that he saw in the hospital if he could become a patient of his. So it was behind the scenes, the nurses were really cute. Wait another day, let him get a bond going. And so finally on the last day, he was like, please, I don't have anyone. Can I be your patient? And the psychiatrist was wonderful. And he's, encouraged him, if you'll go to outpatient therapy and work a little more, then yes, I'm overbooked, but I'll take you on. So don't be afraid to keep pushing and trying to open doors like that, because it is hard to get in with a psychiatrist. Thanks.
Dr. Toombs, did you have something to add on?
Yeah, I just wanted to piggyback a little off of what Laura said. In terms of psychiatrists, it's absolutely difficult, especially here in Chattanooga. There's a severe lack of psychiatric providers in our area. And so one thing that, a lot of people don't know is that family doctors are actually trained in some psychiatric medicine too. And so usually it's much quicker to get in to see a family doctor. There are more family doctors than there are psychiatrists. So I never want people to feel like they have to suffer and that they have to wait because, you know, it may be a 3 to 6 month wait getting in to see a psychiatrist, but your family doctor can certainly get you started in the right direction with mental health. And then you still can see that psychiatrist, when that time arises, but just so that people can know that there is a start and they may not have to wait so long.
That's such a great, I had no idea. I had no idea that you could see your family practice doctor. So I think that's such a good point. Kathy and Amy, y'all's hands are still up. Did you want to add on?
Well, my hand wasn't supposed to be up, but I'll add on.
Perfect.
Amy sees a nurse practitioner who is very well versed. So that's another option for people to get. She's a psychiatric nurse practitioner. She knows her meds inside and out. So that's just another option for people. But there is a huge shortage of all mental health care. People don't know it. There's a shortage of beds, providers. If they had this kind of a lack for, say, if you had a heart attack, you couldn't get a bed for 4 days, there would be outrage, right? But for mental health care, no. So, okay, I'll put my hand down and I'll be quiet. But thank you.
I love that you got up on your soapbox there. That's awesome. And you made a great point. Yeah. I think we've talked a lot about the first visit especially for mental health, but I did want to ask specifically too, like, how do we find the right provider for somebody who's looking for the right birth control, right? So we talked about lists for your mental health. Do you guys have suggestions for our audience when we're talking about birth control? How do we find the right fit for that? Nicole, I see your hand.
Well, I always tell people, ask your friends and family, like, who do they see? Who do they feel comfortable going to? Because that word of mouth is very important because that is a very sacred space, right? So you want to be really comfortable with the person that you see. Probably as long as I've been practicing in women's health, this is like a pet peeve of mine. So first time meeting someone, I don't need to see you naked yet. Like, can we have a conversation first? Because in my experience, going to see a new provider, if you tell me to put a gown on before I even talk to you, I don't want to do that. I've never met you. I want to have a conversation first before we get into a physical exam and things of that nature. So I'm really big on, asking my friends who they've had good experiences with. Did they listen to you? Like, what type of problems did you have? Or if I know of someone that's had a problem that's similar to mine, or similar to a patient's, I'll say, did you get the help or the answers that you needed? And so like asking those questions seem to be very beneficial. So I definitely would tell them to do that. I also tell them to look and see who your insurance company covers if you have insurance. If you don't have insurance, then look for places like Step Ahead Chattanooga that provide these services for free, or look at your local health departments as well. Now, you can't forget your primary care providers because they are very versed in everything. And so they may be a person that may start you on a birth control method, and they may still refer you out, but they're able to do GYN exams as well, and get you on your way there. So you have options.
Thank you. That was a great answer. Dr. Tombs-Withers.
Yeah, those were great tips from Nicole, definitely. And then just in addition to that, I often actually have patients start at Planned Parenthood or at the Reproductive Access site. And the reason for that, they both have excellent comparison charts on their websites, where you can look at all the forms that are out there. You can kind of already, get in your mind what you may like or what may work for you. I often tell women when they're thinking about, birth control to think about your lifestyle. Are you the type of person that's gonna take a pill every day? Are you gonna remember to take it every day? Are you, busy and you prefer something you don't even have to take orally? Do you want to, kind of set it and forget it? So, it depends on, what you're looking for. And so think about all of those things in advance. And then another thing just to touch on, because we also, talked about this disparities and biases, is if you are wanting a certain form of birth control, maybe think about if you have a certain type of religious plan, or you go to a religious facility. Some of what you want, unfortunately, may not necessarily be covered. So, that kind of thing is good to know. I trained in Ohio at the University of Cincinnati. And so, there is a large Catholic population. And so some certain things, play a part into that too, in terms of what type of birth control you may have access to and what may be covered by your plan. So those are just other points to know.
Yes, thank you so much. And even giving us resources. I put one of my favorites, which is Upstream. Awesome. Ricky, I see your hand.
So for me, like my reproductive needs have changed over the course of my life. Okay. So when I was 16, I had different needs than I had, later on. So at first it was just my primary care, and they gave me the pill and she did my pap, and that was great. And we were great for year after year after year. And then I finally decided maybe I want to have a kid, and I needed an OB. So I had to go looking for that. Thankfully she had somebody for me. It was fine. But I had to go looking for someone that birthed babies as well. And I didn't know that was even a thing. I had no idea. And then after that, I was done having children, and I needed a different thing, birth control wise. And I needed someone else to guide me, because now my old guy was retiring. So I need someone new to help me through this new phase. But basically, you just have to know your body. You need to know your needs, and you need to, again, self-advocate for your own reproductive health, and make the decisions with your partners as well. But ultimately, it's you.
And I having a daughter with endometriosis, was shocked after 5 years of having her with the same OBGYN. Like, never was there a conversation about using an IUD to potentially help with her endometriosis. And I was like, once I got my job at A Step Ahead, I learned about this, and I was like, how come your OB hasn't said anything? Like, not a single word. And now, like, thankfully it's been such a blessing, and she was able to get an IUD to help support that. But yeah, so knowing what you need, I think is important, and then reaching out to your resources. I love that you guys offered some amazing tips. Rachel, you want to take the next question?
Yeah, and I'll just say that I think like a lot of the themes are very similar for mental health. I like the piece about, starting with your family care doctor, and reaching out to friends and family. That is a really great tip. I know that we kind of do that a lot internally through Nami. It's kind of the running joke that like a lot of the Nami people have the same therapist, because you find a good therapist and you want everyone to know, so a lot of the kind of same, and always look at your and see who your insurance covers. Unfortunately, sometimes people have issues with not having a lot of providers covered. That's always a good place to start. So next question. So just really generally, again, either speaking to reproductive health or mental health or just healthcare in general, what are some things that a person can do if they feel like a care provider, whatever that is, whether it's a therapist or a OBGYN or primary care doctor or psychiatrist is not listening to their needs or concerns? What do you advocate that a person do if they feel like they're not being listened to? Anyone? Silence.
Awkward silence is good, y'all.
Well, can you hear me?
Yeah. You didn't raise, you raised your real hand, not your virtual hand, but it's okay. We'll take that.
It's too much to navigate. Okay, so it helps to have a circle of care for if you have a mental disorder, and to actually maybe have someone else speak for you. Like I have Amy gives me the availability to work with her professionals. And if I see that she's not being heard, I will speak up. And I, as a mom, getting my daughter the right care, I am like a dog with a bone. I do not give up. And so you just have to be polite and insistent that this is not meeting your needs. And then you might actually have to change providers if it eventually doesn't work out and we've had to do that. But it was the right thing to do. And as a patient and as a caregiver, in your gut, what is right and what needs to be done. And you just have to follow that as a caregiver.
And I spent a lot of time being silent about my symptoms and just riding kind of this edge of being in pain and discomfort and going through things, but stabilized at the same time. And I found that when we changed providers, I was able to start talking about my symptoms with my new therapist, and then realized that actually helps prevent episodes and relapses to actually address the symptoms instead of keeping them a secret all the time.
Yeah, so maybe
I would be forthcoming about some things, but not all things.
So maybe when you have the right fit, you feel more comfortable actually talking about your needs. Is that kind of what you're saying?
Yeah.
Thank you.
Mm-hmm.
Insightful. Anyone else want to take a stab at that question? We don't like that question apparently in this group. We don't want to address our concerns or needs, man. Oh, Laura.
Okay, this is going to sound sort of like stupid, and I know you're not supposed to say that, but I mean, I do think sometimes I go into an appointment in a frame of mind maybe that's not receptive to a certain person. I try to give a couple tries before making a switch, but if I can't get there after trying a few times, then yeah, I think there's nothing wrong with making a switch at all, and encourage him to do so also. So simplistic answer, but anyway, thank you.
Nicole, I see your hand. Yay.
Well, as a provider, I never want anyone to feel like they're not getting their needs met with me. And sometimes it can be a personality thing. And I don't take it personal if someone decides that they want to see someone else. I much rather them get the help that they need versus staying with me and not feeling like I'm not hearing them. Okay. I'm not perfect. And if I miss something or if there's a misunderstanding, I definitely would be like, you know what? I dropped the ball there. Let me help you find someone else. If you don't want my recommendation, definitely find someone else. Like, it's okay. I've left probably good providers before, but we didn't mesh and our personalities didn't mesh. It's funny that this happens. I am like literally in the transition of leaving a practice that I've been to for probably 21 years. My provider moved to Nashville. I love her and I'm going to miss her so much. And it's for my GYN care. She delivered my baby who's now almost 17. And there's like no one in her practice that I felt like I meshed with. And I saw 2 different providers since last year. And I don't like neither one of them. I don't feel like they listened to me. I don't think that they heard me. We just did not mesh, and it's okay. And it's funny because they're colleagues of mine. They're nurses and nurse midwives. And I'm like, yeah, we are not vibing, and I'm okay with that. I'm going to move on and find someone else that I felt listened to me. And, I'm not in the place where I'm wanting to have children, but I knew I was having a mysterious pain. And it turns out that I had a huge ovarian cyst, and it ended up rupturing for me to find it. Whereas they didn't hear me when I kept saying I was having this pain. They couldn't hear me. Oh, we don't feel anything. Oh, there's nothing there. No one offered, and I advocate for myself. No one offered me to do a ultrasound. I offered for them to order me one. So I think it's important for you to do those things for yourself. And when I had my rupture, I was at home thinking I got food poisoning, but I was persistently vomiting. And I was like, this is weird. I'm having this weird pain. And I called my colleague, who's now my new women's health provider, and said, I can't get to your office till Monday, but I need to order a CT scan. Like something's wrong. Something's wrong. This is not normal. And that's what happened for me. So I think it's always okay to move on. It's okay to find someone else. It's okay to sever a relationship for the benefit of your own health, period.
Thank you for sharing that story, Nicole. That's very, very powerful. But I think about those folks who don't have a medical background, right? Like that's the scary part. Thank you for sharing. Dr. Toombs, I see you.
Yeah, just piggybacking off Nicole. That's the other part to self-advocating and being with a provider, who you feel comfortable with talking to, because sometimes what happens, like you said, Michelle, for those who don't have a medical background, but then if they don't feel comfortable, with that person they're seeing, they may not even bring it up that, oh, I'm still in pain, and oh, something's still not right, and until things have far, progressed just way too far. And so that's the other part of that self-advocacy, and being very comfortable with whoever your provider may be, so that you are comfortable enough to tell them, this is what's going on, this is what I feel, and to have developed that relationship with your provider too, so that they know that, oh, I know Miss Johnson or Mr. Johnson, really wouldn't stress about that unless it was just really, something going on, because you've developed that relationship too. And so that's, those are important.
Yeah, absolutely. I think relationship building, it's important in everything that we do, but most importantly in healthcare, because you aren't going to feel trusting or open to say anything if you're not. So thank you for that, for chiming in at the last minute, y'all, with beautiful things to say. So we are at 7:30 with a half hour left, and I do see some questions popping in the Q&A, which is amazing. The next question kind of goes back to listening to concerns, but if you're already on a treatment plan, how can you tell your doctor? So if you're taking a certain birth control or you're on a certain treatment plan for your mental health, how can you tell your healthcare provider that plan is not working? Back at it, Dr. Toombs, go ahead.
I can start with that one. So one of the things that I ask my own patients when after I've started them on a particular medicine or a treatment plan, is to determine, one, how do you feel? And then two, have you noticed that it's been able to change any aspects of your daily living? So if it was a depression medication, and before, you may have not been able to get out of bed because you were so, down and depressed and chronically fatigued, or so now are you able to go out and go for a walk? Have you felt like, going to play with your dog more, or, so not so much as to just, are you depressed anymore? Has this medicine fixed you? But has it changed some of the aspects that your health condition were having on your life? Have you been able to change some of those aspects? And so, relaying that to your doctor, to your provider, if those aspects of your life that were being impacted, if those things are improving, that's one way to determine if that medication may be helping or if it's not. The other thing, of course, are side effects. So when you're being started on something new, you should always be told what those potential most common side effects are. There's some things that, some medicines, unfortunately, may have a, whole laundry list. But you should be able to be told what those most common things are going to be. And so, and know to look out for those things. And so if you do experience any of those things, certainly making your doctor aware of those side effects that you may be experiencing as soon as possible, so that you don't have to suffer and just feel like, oh, this is just how it's got to be on this medicine. Because there are many other treatment options out there. A lot of times it's just finding what works. I often tell people, especially with mental health, I can line up 10 people and give, them all the same medicine, and it may work for 2 of them, it may not work, and 5 of them may experience one thing and 5 may experience something else, but we don't always know right off the bat who's going to experience what when we start a certain treatment plan. So it is important to talk to your doctor and give them that feedback.
Great, thank you, Doctor. Ricky?
So I think it was Amy earlier that said it's like a trial and error. There's not a process, it's a process. And that's kind of what Dr. Toombs just said too. So, like when I came home from the hospital, I was on 600 milligrams of Seroquel, which for any of you that know, that's like, you kill an elephant with that, basically. Like I could barely even walk. I was a zombie. And I said, I can't do this. If this is my life, I'm done. I can't do this. And I said, I'm not trying to be suicidal. I'm just telling you, I can't do it. And so we called my doctor and they lowered it and they lowered it. And they got to me where I was functioning. I'm on, I think, 200 milligrams of Seroquel now. It's a much lower dose. But I had to be the one to say, this isn't okay. What's going on isn't okay. And I had to call my doctor. And my husband did too, because he knows me. We've been married forever. And he saw my face and he was like, that's not you. He knew. So he knew we had to get that under control. But it's a process. So I knew I wasn't immediately coming off 600 and going down. I just had to trust that eventually I would be okay. So you have to be safe. You have to be in a safe place to do that. And that might be the inpatient. You might have to go inpatient for that to be safe. So you just have to, again, self-advocate.
Thanks, Ricky. That's powerful information and advice. Thank you. Nicole?
So I'm gonna switch gears just a little bit on the women's health side of it. Whenever someone comes to see me and I start them on a new birth control, just out of habit, I bring them back in a couple of months just to see how things are going, right? Are you having any side effects? I explain before we even start on one birth control, I go through all of them and give them all of their options, even those things that are not invasive, barrier methods, all of those things, right? Just so they have an idea of what's there so that they make that decision, right? And if they go home with what they thought was going to work for them and they have irregular bleeding or more cramping or things are, I'm not remembering to take this, I need something else, I tell them, call me anytime, like really call me anytime and let me know so that we can work this out and find something new. So I think it's important to have that open relationship so that when you know something's not right, you can get right back in and say, I need, this isn't for me. And feel comfortable in knowing that it's your body. We want you to be healthy. We can't tell you that this is what you absolutely have to take and there's no other option. We can tell you what research says and what evidence says out there as far as on the medical side, but that's it. And ultimately you have to make the decision. If you start something that you thought was amazing and it turns out not to be, we have to change it. So I think that from my perspective, that's something that I want to make sure everyone knows when they do that. Now, if you do have that conversation and they don't change, then what did I say before? It's okay to leave and find someone else that will actually listen to you. And it's okay. And I know that sounds so hard to like start anew, but you got to do what's in the best for you every time.
I love that. Yes. Back to the point, you can leave. I love that. Kathy and Amy.
I just wanted to say one of the challenges that people with a mental disorder face is there's no blood test, there's no x-ray, there's really nothing to tell or predict what medicine will work. And sometimes it can take months or years to even get stabilization with the proper medicine. And, you know, we're from the Midwest, we're real straightforward speaking people. And you just say, hey, this is not working. It's not working. So,
And sometimes it does take a trip to the hospital because then they know you're in crisis with it. You know, it's sometimes hard to communicate and what exactly is happening. I'm in pain, you know, I mean, what does that mean? You know, or, so for me, I went for a long time without treating serious depression and psychosis. And I had to get to the hospital to get on the right antidepressants and I was going, I mean, for years at a time, just in pain from the depression and from stress. And so my point is that I think sometimes you have to go to the hospital from my point of view, from a mental health perspective.
Yeah, and I think that, you know, Michelle, I think we were talking just randomly about how sometimes it can be hard to convey like the seriousness of what you're feeling to a provider. And I think that like in the mental health field, unfortunately, one way you convey the seriousness is you have to go to the hospital. Unfortunately, in some situations, it's like, you know, that's how we know it's serious. It takes getting to that point. And hopefully, you know, if you have a great relationship with your provider and you feel like you can speak openly and honestly to them. And Nicole, I love what you're saying about call me anytime and, you know, be open and like kind of have that open communication. Hopefully, you know, it doesn't have to get to that point in every situation. Thank you, everyone.
Yeah, and I think back to like what Dr. Toombs was saying is like, it's that relationship, right? And so like Nicole had that relationship for 20 years, they gave birth to the baby, you know, or helped give birth to the baby. And like that relationship, you're like, oh my gosh, I have that. I have like a nurse practitioner I've worked with for 15 years and she sees my whole family. And when she got a new midwife in there, I was like, no, I don't want to work with her. I want my doctor, you know, or I want my nurse practitioner. And so like starting, I think too, like for me, just breaking down barriers within myself and like, you know, Laura, I saw your hand up. Don't try and hide.
You can't put it down. You guys.
No, up, down, up, down. My ADD, I forget what the question was after I get to a point, but Rachel was talking about knowing when you have to go in and having to go to the hospital. I think my son, I was asking him what self-advocacy meant for him. And he said, well, I really don't know because it usually means I have to go to the hospital. And that's when I need you to help get me there. And so there are phone calls. and it may be to the crisis team or to 911 or, you know, whatever, that are really hard to make as a parent. You don't want to do it, but you also know that he's not getting better by himself. It's not, and there's no reason to wait to try and get help if you can, or at least in my experience with him, once he starts in that state, it's just really hard. He needs a reset, I guess. And so, so you got to make the hard decisions sometimes for him.
Yeah,
and that's it.
Bringing up a good point from Laura is that sometimes, you know, it seems kind of silly and counterproductive, but sometimes self-advocacy can be like giving those that you trust and those that you're close to, like, the ability to advocate for you when you feel like you can't advocate for yourself. Because, you know, the reality of serious mental illness is that sometimes people, you know, really can struggle to advocate for themselves based on, you know, how severe their symptoms are. And, you know, sometimes it can be really hard, you know, especially in that inpatient setting where they're a patient somewhere. And so sometimes that self-advocacy can be like, you know, making sure that those around you in your circle are able to advocate for you. That's a good point.
Yeah, that is a good point. We are 17 minutes out, y'all, and I think we're going to do 2 more questions. The next question, which I'm excited for this one, is how can one advocate for themselves when they're faced with bias by a healthcare professional that they're seeing? I don't know if anybody's experienced that on the panel, but maybe one of your clients or somebody you know. Laura, back to you.
Okay, I'll be quick. One of the comments we always get when Will is in psychosis is, oh, is he on heroin or is he on meth? And he's not. That's what his psychosis looks like, and mania. And so, you know, you have to go through the list. I'm there to help say, no, he's really not. This is what it looks like. And we go to the emergency room and need to say the same things. And of course, I understand the question and all that, but there is a bias immediately that it's some kind of choice in some ways or something he's done, not just something that happens to him as part of an illness. Oops, sorry.
Yeah, I love Rachel put in the chat. Yes, that's a bias we didn't even bring up because there's so many. There's so many. Nicole, I see your hand.
I was just going to say, sometimes people just see you and have a preconceived notion as to why you're there. I have a lot of pelvic pain patients, and so the assumption is they're drug seeking, they're this. No, they're really in pain. So it's not a fair statement to say that about them. You know, you also get the appearance of someone. You assume that they are young, or they're a young mom, or they're a single mom, and you know, and so now it's like, she's probably going to have a bunch of kids. We need to make sure she gets an IUD. Those are wrong things to say to people, and those are wrong assumptions to make. And then I guess in my situation, my bias was I was a healthcare provider, and healthcare providers weren't listening to me, right? They were looking at me like, oh, well, if it was really something, she would have called us. No, I did call you. You just didn't listen. You assumed that it was just a Black woman who has a high tolerance for pain, because this is what is taught. And so when I'm telling you that I'm hurting, you're not taking me serious because of what's been taught to you about my population of women, people that look like me. And so it's not fair. And so, you know, I think that everybody should just on a day-to-day basis know how to check their own biases and know what they are and be very aware of them. And so when you are having conversations with people, you can take a step back. I think silence is golden, and sometimes people need to utilize silence to actually hear people versus just being reactatory. And that happens in healthcare way too much, where you see someone and you automatically go to this bias that you know, or you think that this person is here for, you think that this is what it is, versus just really investigating and trying to figure out what the problem is. And I think just healthcare in general needs to do a better job of that, instead of making these wild assumptions about people.
Those are great comments. And I agree. Dr. Toombs?
Yeah, and actually, I was going to touch on what Nicole kind of hinted into about in healthcare. There have been studies that have shown for Black women, one of the reasons that we have one of the highest maternal mortality rates is because of biases in healthcare. So it all goes back again to that self-advocacy. And as we were discussing with our mental health, people who suffer from mental health issues, having an advocate for when they aren't able to advocate for themselves, the same is important in maternity care too. One of the things that we found, in helping to reduce those risks of maternity mortality is when those women, those new moms can't speak up for themselves, having someone else, a spouse or partner or whomever, a mom, speaking up for them, so that they are listened to, that they are heard, and so that we can, help to decrease one of these very, very, well-known health disparities that we do have in women's health.
Some good points. Laura, your hand's still up. Does that mean you want? No. Okay.
No,
just checking in. Yeah.
Okay. So I think this is my question, Michelle, right?
Yeah.
Okay.
Those are great answers.
We're going to do one more question, and then I think we're going to talk about resources, because we want to make sure that we especially highlight what both of our organizations have available to people that we want to make sure people know about. So last wrap up question. Specifically, it's going to either be from your lived experience or what you've seen in your practice. What do you feel like is the biggest barrier either you or the people that you serve have had to overcome in getting quality care? What's the biggest barrier? Dr. Toombs Withers?
Yeah, the biggest barrier I see that people have is access to care. It's part of one of the reasons I opened my practice, is that, we have a lot of people in our country who are uninsured and can't afford quality health care. Then we have people who are insured, but they can't afford health care with the insurance that they have. They have, may have a very high deductible that there's just, no way that they're going to able to financially reach that to still be able to access health care. And so part of gaining quality care is having access to care in general. And then we also, still have a shortage of healthcare providers a lot of times in a lot of areas. So those are all points. It's important for people to know, regardless of if you have insurance or if you don't have insurance, that there are ways to get care. We have several community healthcare clinics within the Chattanooga area that are able to provide care to people regardless of their financial status. They have sliding scale rates, they have free care, there's homeless care available. There are, our traditional private practices who you can find through your insurance and see who's in your network. Then there are practices like mine that are more cash-based membership type practices, for the cost of a cell phone bill that you can get health care that way. So there are different ways of accessing care, but knowing what's out there and knowing, what may be available to you is very important.
Thank you. Ricky?
So the barrier would be, one of them would be based on like if I'm in crisis, and the other would be if I am medicated in a good space, but I need assistance, I need a doctor, I need someone to give me therapy. So if I'm in crisis and I'm looking for someone, the barrier is sometimes myself, because I know Amy and I both said sometimes you have to go to the hospital. Nobody wants to go to the mental hospital. It's awful. It's a bad experience. They do the best they can. They take great care of you, but you're in a really bad space in your own mind. And it's hard being away from your family. It's just a bad experience. So sometimes it's me, I'm the barrier. But if I'm looking for care, I'm in a good space. Let's say I've come out of the hospital and I'm stable. It's what Dr. Toombs was saying. It's finding those resources. I thought, oh, I had excellent healthcare. I do. I have excellent healthcare. I'm going to find a doctor, no problem. So I got this list and I started calling, and I didn't find one. I was 20 down before I found one, and that's with excellent healthcare. So that's a barrier. So there's two different kinds for me.
Thank you. Great point. Anyone else? What's the biggest barrier you've had to face or you've seen other people have to face? Nicole?
Yeah, I was just going to say insurance sometimes is a huge barrier, and being a provider and knowing that I want to order something or I want to get something from my patient and the insurance tells me I can't do that. This isn't covered, or this procedure isn't covered, or this imaging isn't covered. That is a huge barrier for me. And I know we could probably talk about that all day long as to some of the reasons, but as a provider, it's very frustrating for the insurance to dictate how I care for someone. And so I do work with my patients. I am writing every PA that I can to get that thing covered. I'm doing peer-to-peers with them. I'm trying my best to do what I can. And so I think it's important to have providers that will fight for you in that manner and will do those things with the insurance companies if they can to get those needs covered for you.
I love it. Laura?
I'm going to be controversial here, maybe, but HIPAA is sometimes a barrier too. You know, you can't get any information. It's hard sometimes to know that you can give information, just finding the right person to hear it about your loved one. So yeah, some of it's just as simple as that. People can't converse and talk sometimes to come up with the best plan together. So anyway.
Good point. It can be hard to kind of have that circle of care sometimes without everyone being on the same page. Any thoughts on this? We have 5 minutes. Michelle, you want to go to resources if there's no last thoughts?
Yeah. I have like too many windows up. Of course. Here we go. Can y'all see now? No, I'm drawing on you.
You have
I did.
Are you going to give us a doodle there?
I know. I'm like, oh, I'm going to doodle all over you. Okay. Boom. There we go.
There we go.
All right. Did we have any? I think we had a really great question in there, Rachel, that you responded to. I don't know.
I'm going to talk about that in the resources. So
okay, perfect.
Yeah.
So these are some resources on the Nami side. So if y'all are on a computer, you can, screenshot, and on the ASAC side. So I'll just talk briefly, and then Rachel, you can go at it. So we are available Monday through Friday on the appointment line. If you know somebody or want to share our resource, we provide IUDs and implants. They can just call our appointment line at 423-2665-STEP, or you can find out more information at stepAheadChattanooga.org. And we have affiliates across the state of Tennessee. So even if you aren't here in Chattanooga, we have you covered in other places. And then I wanted to throw SIMPA Community Care when we're talking about like reproductive or sexual health too. So they offer HIV, testing, and some education as well, all for, I think, sliding scale and free too, if I'm not mistaken.
Hey, Michelle, SIMPA also does prep.
Yes.
if
Oh
they're
yeah.
interested in that
Thank
too.
you.
Yeah.
Thank you, doctor.
Also, so I don't think that we mentioned this earlier, but I put this in the chat that we both have like resource guides, right, Michelle? I don't know if we mentioned that.
We did briefly.
Okay, that we're going to be sending out later with these resources on there, so you don't have to like screenshot it or write it out or anything like that. Lots of good resources. On the NAMI side, we have a helpline. You just call our number 423-521-2590, and that is answered, not ants, by someone who is a NAMI Chattanooga volunteer who has lived experience. So, you know, they can talk about what has worked for them. And the majority of the people who are involved with NAMI have at some point been involved or still involved in NAMI programs that we offer. And so this is a really great resource if you're like struggling with how to have this advocacy conversation. If you're struggling to find the right fit, like we can kind of walk you through some of those different issues and barriers that you may run into. We have resources, mental health resources on our website, namichattanooga.org. There's also, I have on here, the Tennessee Department of Mental Health Helpline, and you can call them if you would like to submit a complaint. So if you are ever in a situation where you're just like, you know, I need to submit a complaint about a provider, you know, we hope that no one gets to that point, but if that is ever an issue, there is an avenue to do that through the state. So that's just good information to know. There's also a lot of really great resources on NAMI.org's website. There's a really great guidebook. And also NAMI Chattanooga offers some great free programs to our community. And both of the programs that we currently offer are focused on empowering and supporting caregivers of people with mental illnesses. So we have monthly support groups that are for family members of people with mental illness. And we also have a free education course called Family to Family. And some of the course content is about that, like how to advocate for your loved one topic. So it's got that in there. It's got self-care. It's got, you know, boundary setting. It's got all the things wrapped up into this program. And so that's another amazing resource that's available. And our website for us is namichattanooga.org. And yeah, if anyone needs anything, we are here to support. There's our email, phone number, reach out to us. Thank you.
Yeah, and for a step ahead, you know, just thinking about more on the access side. So where everything we do is free. We do free education on reproductive health, but even, you know, moving away from that and talking to youth about healthy relationships and consent too. So all of that can be found on our website. So with that, I want to say thank you first and foremost to our wonderful panelists. Y'all were fantastic, and I am just so grateful that y'all said yes and showed up, and for our audience for also showing up and listening to these tough conversations. And I hope we can continue having these conversations, and we're going to change the system, right? Just by talking about it, y'all.
Fight the stigma.
Yeah. I'm going to stop sharing. Thank y'all so much. Have a wonderful, wonderful night.
Thank you, everyone.
Bye.
Sorry, I messed up my time zone.
No, Ricky, you were fantastic. You did great. I loved it. Wonderful.
Thank you so much.
Yeah. Thank you so
liked it.
much for showing up and being so courageous. Sharing
Yeah,
your
you're
story.
welcome. Bye.
Yeah. Bye.
Bye, Ricky. Good to meet you.
You too.
I know.
Bye,
Thank you,
y'all.
everyone.
Nicole and Doctor, did y'all know each other before?
Briefly, we've met,